Hi. Hi, official PM. What's this? I don't know how to pronounce your name. I'm so sorry, please. If I mispronounce your name, I'm so sorry. So today we'll be talking about who should be a consultant in public health. But let's wait for some minutes. Let's wait for a few people to join. We'll wait 5 minutes, then we kickstart. Okay, so we'll wait 5 minutes. Augustine Adube, right? I hope I got it right. Okay, thank you. You're still waiting, but okay, let's just kickstart. Who should be a consultant in public health? What is public health consulting? Public health consulting is a public health professional who has the knowledge and the experience to solve a client's problem. Who is a public health consultant? A public health consultant is an individual who has the education, the experience, the training to prevent disease, prolong life, and promote healthy lifestyle choices among the people. So after that, what do public health consultants do? Public health consultants, they do various things. They work with organizations, they work with healthcare organizations, they work with non-governmental organizations, they work with businesses. Then what do? Number one, they do training and technical writing. They do training for organizations to help them expand their capabilities through solving their public health outcome. Number two, what do? Health communication. They help with strategic campaigns to help prevent the spread of a major health issue or an outbreak. Let's say, for example, in the case of the coronavirus, I'm sure they were consultants working with the CDC, working with National Institute of Health to help prevent, the risks, the outbreak by spreading the right information to the target audience. What do? They translation and dissemination of data. They interpret data into the right information and disseminate it to the people that need that information. So you'll be thinking, what are the skills? What skills do they have? Public health consultants. Number one, you must have a written skills. You must know how to write. You must know how to write technically. You must know how to tailor your message according to your audience. Number two, that's written communication. Number two, verbal communication, because as a consultant you work with various organizations, you must know how to communicate with others, work in a team. So and again, aside from that, number three, your critical thinking capability, ability to be able to interpret data into a product. Let's say, for example, there's an app right now that we have that you can use that was created for Black women, used to interpret that. Let's say I don't know, I can't remember what the name of the app is. The app, you use it to rate your doctors on what's on their ratings. Just give them ratings of how they performed so far. So you know what that does is, I'm sure it's based on research. That's the consultant right there. That person is thinking. That's a critical thinker. Another skill for public health consultants, you must be able to have analytical skills. You must be able to analyze data. You must be able to analyze data into simple forms for people to understand and disseminate the information. Those are the skills you need as a public health consultant. So you're thinking, what do these people do? We already mentioned 3 things they do. We already said, first, they help with training, strategic communication. They help with consultants help with organization. They are the ones that create programs too. They help carry out research. They help carry out accurate research for an organization. Let's say a non-governmental organization or government organization, they need people to help them carry out a research, implement research design, and they carry it accurately, and they are able to meet up within the stipulated time and be able to meet up within the budget. Those are the things public health consultants, those are the things they do. Aside from all that, you'll be thinking, who should be a consultant? For me, any person who have the knowledge and the experience can be a consultant. What do you need to be a consultant? You only need your MPH degree. You only need your roles. You need your experience. Yes, that's what I mean. You need your experience to be a consultant. It's not a rocket science. You don't need 20 years experience. Though according to research, you need to spend 5 years with an organization before you call yourself a consultant. But me, I'm going to tell you personally, for you to be a consultant, you just need probably 2 years experience. As long as you have the required skills, you have enough experience to be able to train others. As long as you have been able to train others in your organization for certain roles, you are already ripe to be a consultant. So as a consultant, people will be like, okay, who should be a consultant? You're a consultant. You should be a consultant if you have had the capability to train other people in certain roles. As a public health consultant, you are an entrepreneur. You are an entrepreneur. You'll be wondering, I talked about public entrepreneurship masterclass and all that. You are an entrepreneur, but you are not really an entrepreneur, because a public health consultant, you are working with organizations and you are working independently, determining what time you want to work. You are the one that decide whenever you want to work. You are the one that giving them their budgets. You have given them your work plan, and to be able to achieve the work. For you to achieve the work is not their problem. It's your work to do, to be able to achieve certain work that was given to you, be it the federal government, be it the non-governmental organization, be it the healthcare organization. So whatever job they give to you, it is your job to be able to meet up. So where entrepreneur comes in is when you are able to understand who is your audience, who are you trying to solve your problem for, who are you trying to target. That's where entrepreneurship comes in. Entrepreneurship comes in when you are trying to decide, how am I going to get the funds to start my own business, to start my own public health consulting business? Who do I meet? Where do I start? That's where entrepreneurship comes in. How do I source for funds? What's going to help me maintain my business? How do I stay relevant? The strategy to be able to maintain your public health consulting business, that's where entrepreneurship comes in. So as an individual, as a public health professional, what you need majorly, I said it, your experience, your master's degree, and there are certifications you need to take for you to be a public health consultant. I know of 2 major certifications to take for you to be in the market. If you're an health education and health promotion specialist, you can take the board exam for health promotion and health education. It's called Certified Health Promotion and Health Education. If you are somebody that had maybe done roles on administration, there's a board exam in the US where it's called Certified Health Administration Specialist too. So all you need to do is just to take those board exams and you are good to go. That's if you are looking into certifications. Really, you don't need it that much, but I advise people, anything that would give others advantage over you, don't leave room for that. Always, Take everything seriously. If there are certifications, whether you need it or not, just take it. You understand? If that's what's going to market whatever you're doing, take the certification and take it seriously. So now I'm going to be asking you, as an individual, do you think, as a public health professional, do you think you are qualified to be a consultant? Do you think, with my explanation, do you think you are qualified to be a consultant? Augustine, are you there? Do you think you are qualified to be a consultant? Yes, by training, yes. So the reason why I'm doing this is because I know a lot of times, a lot of people will believe that for you to be a consultant, you have to spend 20 years, you have to have 20 years experience and all that. And again, the way the word consultancy is being used, maybe in school, in various organizations, people tend to believe that for you to be a consultant, you need a special skill. You really don't need too much to be a consultant. All you need is your skills, your competencies, taking those exams, having the training capability, having the experience, having the education. That's all you need to be a consultant. So if you are looking to be a consultant, there are steps to take. You have to know the entrepreneurial part of public health. That's why we're talking about masterclass on public health entrepreneurship. By privilege of my training, I'm a consultant. For me, I have a master's degree in health education and promotion. So I can decide if I want to work with organizations. I can decide to work with maybe CDC, National Institute of Health, to be a consultant, to help them with strategic campaigns that will get to the right audience, to prevent outbreaks, to prevent health risk. You understand? So another thing public health consultant does is they are the ones that help you with surveillance, public health surveillance. Let's say, for example, you're an epidemiologist. They are the one that creates the tools. They create the tools and maintain the tools that is used for data collection. They are the ones that update it so that they collect the accurate data. So if you are thinking, what can I do? Depending on your field, we have discussed about health promotion. We have discussed about health promotion and health communication. We have discussed about translation of data into simple form for your audience, for the people that need it to get the information, translating and dissemination. So you want to look into this area, public health surveillance, training and technical capabilities. You want to look into these areas to do it. But the truth is, to be able to kickstart, to be able to get to this the people that you will serve, you need to have the entrepreneurial knowledge, because you only have to have a knowledge of entrepreneurship to know how to do it, how to kickstart. Who is your right audience? Who are the people to work with? Which organizations should I focus on? What's their, it's only the entrepreneurial skills that help you determine to, differentiate between what organization do I want to work with? Which one, goes with my own goal. As every organization have a team, they have what they are doing, they have what they are dealing with. For we have organizations that what they are after, their goal is to help with HIV/AIDS. We have organizations that their goal is to work with children. We have organizations that their target audience is women. That's where entrepreneurship comes. Entrepreneurship will help you, to clarify where is your audience, where do you get your audience, how do you get these clients coming in, how do you sustain them, how do you maintain them. That's where entrepreneurship comes in. But the truth is, as a public health consultant, you're an entrepreneur, but you are not yet an entrepreneur until you get the training, the entrepreneurial part of public health, so that you will not be stuck while doing this. You understand? You want to be able to work, you want to be able to have a sustainable kind of work. You want to be able to know that you know what you're doing. You want to be able to stay long. Entrepreneurship is what keeps you in that business for a long time. You want to be able to have the right strategies to kickstart. So for public health consultants, if you're thinking, what can I do? We have already simplified what you need to do. We already simplified everything, all the things you do, the years of experience, the certifications, the skills. So I'm happy that everyone is able to learn today. You're able to learn that, okay, this is what I need to do to be a public health consultant. Then I want to ask you one question. What is stopping you from being a consultant? What is stopping you from being a consultant? Are you me? Augustine, what is stopping you from being a consultant? Yes, what is stopping you from being a consultant? Okay, so in other words, we're able to, answer your question. We're able to simplify what makes you a consultant. Nothing, already securing opportunities for myself. Oh, that's good. That's good. You're already securing opportunity. It's the right step. The truth is, any decision you want to take in life, it just takes boldness. You won't have everything. You won't have everything figured out. You just have to take the boldness to decide what you want to do, and you have to be clear with your goals. You have to be clear with your mission, the vision. Why are you doing what you're doing? Those things are very, very important. So what steps have you taken? How many organizations are you looking into? What steps have you taken to be a consultant? What organizations are you looking to work for? Okay, so if you are thinking of what organizations can I work for, you can work for Deloitte, you can work for CDC, you can work for National Institute of Health, you can even work for depending on your country, you can work for the federal government in your country. Where's that? Multinationals, yes. NGOs, yes. You can work for multinationals. You know CDC is a multinational company. You can work for WHO, World Health Organization. You can work for United Nations. So you just have to broaden your scope. I'm happy that you're taking the right step, because the truth is, the reason why I'm doing this lecture today is to clarify and to make others know that you don't need long years of experience to be a consultant. All you need is your maybe few years of experience and your capacity to be able to train others, and the education. That's what you need. If you are in any position to be able to train others, you are a consultant. You don't need too much. So you are looking out for, if you want to work for let's say you want to work for CDC, you have to learn how to write proposals, report writing. Those skills too, they are very important. If you want to be a consultant, report writing is very important. You want to be able to give them reports. You want to be able to communicate with your clients. Report writing, you want to think about proposal writing. Yes, as a consultant, you don't have to, but for you to be a consultant, you want to give a proposal, you want to give a budget to certain organizations. So you can either hire somebody to write your proposals for you, or you write your proposals yourself. So we're talking about report writing, proposal writing. You know what it takes. I'm just happy I'm able to to answer those questions. Do you have any question whatsoever about public health consulting? Do you have any question? Okay. So was I able to answer all your questions whatsoever? Is there any complexity along the line while looking for yours? Are you facing any challenges whatsoever? So what's that? What challenge are you facing? What are the challenges you're facing? Oh, thank you so much. I'm happy you're able to, gain something from this session. So let me just leave you with this. For public health professionals, go outside there. Whether you get your job or not, you can decide to be a consultant. If, let's say, for example, you had worked maybe several years. Oh, okay, you're saying securing the right opportunity to harness your skill in project management. The right opportunity. How many organizations are you talking about securing? You mean securing the job to harness your skill in project management? Right opportunity to harness my skill in project management. I think what you need to do is look out for organizations that that needs. Okay, that's fine. Look out for organizations that needs project managers. Look out for what you need to do first. Try getting a job. Maybe it might be a freelance, a volunteer job for project management. I know of one with UMV. Maybe you can just chat me direct. I will send you the link. They look for project management. You work from anywhere all over the world. So you secure a project management role. You use that to build your experience. From there you'll be able to learn, to have all the skills required. You're able to function independently. As a project manager, you can actually be an administrator too. You can be a consultant. When it comes to helping, you can help organizations set up, train their workers on administration, how to interact with, how to plan programs and everything. So all you need to do now is to look out for, I'll send you a link. Just inbox. If I don't give you the link now, please just chat me up directly, DM me. I would send you a link for UMV. You can actually start getting experience. The more you do it, the more you are able to train others, and come out as a consultant. You can help organizations manage their projects. You can help them. But you want to show them, for you to be able to get clients. Let me just give you this idea. In project management, you want to be able to show the past work you have done. You want to show them what you have done so far, how many people, your client's success. So one strategy to do is to first, offer free. You want to offer free some of your training, some of your work. You want to offer them. You want to look out for people that need your services and offer it for free. Maybe freelance, volunteer to offer it, so that you can put it as part of your portfolio, that these are the people you have worked for. Because for people to give you and trust you with consultancy, they need to see what you have done so far. So you build what you have done so far. You use your years of experience at work. You use what you have done for other clients. Then you add your biography, your proposal, what you are proposing to them, your budget, And again, there's something called a retainer in public health consulting. How do you retain this client that they can come back? You can do something like maybe a six-month program for them. You can do a 6-month program for them that, okay, for this period of time, I'm going to be training this and this for this particular price for 6 months. That's like a retainer. You're retaining those clients for 6 months. So you know that you have a job for 6 months. So it's just having the right strategy. So first thing first, you want to look out for places where you can use your skills, the strategy, offer your services free, so you can list all the people that are successful. You can list all the people that are successful from your skills, then you're able to launch. That's all you need to do. Did I answer your question? Did I answer your question? Okay. Did I answer your question? Are you with me? Augustine. Okay, I'm happy you're able to learn something from today's session. So this is what I'll do. If you want to be in my public health masterclass training, it's going to hold on May 27th. So I'm going to give you free. It's going to be free for you because you joined this session. I'll train you free on public health entrepreneurship. Just let me know so I can add you. Send me your email, your phone number, and everything. I'll train you for free on entrepreneurship so you can have the idea of how to kickstart, what to do, where to go to, how to identify the right audience and everything. Then we'll take it from there. I'm so glad I'm able to answer your questions today. In the absence of no questions, you are welcome. In the absence of no questions, I'd like to end this session. All right. Have a blessed day. You're welcome. Yes, just send it to me. Send a direct message to me. Your email address, your full name, and everything. Just send it to me. I'll get back to you.